Hello, my name is Teresa Bowers and I'm a Clemson University FNP student. Today I will be presenting case study number 2 for Nursing 821. Patient is a 48-year-old Caucasian female who presents to the office today with a complaint of headache times 4 days. History of present illness includes a constant dull headache which intensifies with postural changes. Patient experienced nausea and vomiting twice on day 1 and once on day 2 after onset of headache. It is resolved at this time and has been for the last 2 days. Patient denies any vision changes, photo or photosensitivity. Pain is specific to the occipital region of the head. The headache has been unresponsive to both Imitrex and Excedrin migraine. Patient also complains of intermittent right ear pain, cough, and sore throat. Review of symptoms reveals a complaint of fatigue with a non-productive cough, but without any associated shortness of breath. Patient denies palpitations. She has had recent nausea vomiting, which has resolved. She denies weight loss, appetite changes. She complains of burning with urination, but denies urgency or frequency. She complains of ongoing low back pain, but denies any loss of range of motion. Neurological symptoms include those that are noted in the chief complaint. Past medical history includes tonsillectomy in 1983, cholecystectomy in 2004, right rotator cuff repair in 2008, anterior cervical discectomy in 2007, posterior cervical discectomy in 2011. Past medical history includes depression, anxiety, migraines, earaches, sinus problems, and early onset menopause. Patient is G2, P2, and A0. Social history. Patient is married and lives with her spouse and her adult daughter. She is currently a pack-a-day smoker but denies alcohol use. She has no known drug allergies. She does suffer from seasonal allergies. Her current medications include sertraline 150 milligrams a day, Topamax 25 milligrams twice a day and 50 milligrams at bedtime, Zyrtec 10 milligrams daily PRN allergies, and Imitrex 50 milligrams PRN migraine headaches. Focus PE shows that her TMs are pearl without bulging and no erythema. She does have increased cerumen noted in the left auditory canal. Eyes are pearl, denies vision changes or photophobia. Posterior pharyngeal wall and uvula are erythematous and mildly edematous without exudate. Frontal and maxillary sinuses are tender on palpation. Posterior cervical, suboccipital, and postauricular lymphodemas noted with tenderness. Superior trapezius muscle spasms are noted at the cervical junction. Lungs are clear to auscultation with diminished in the right lower lobe. She is negative for Romberg sign. Muscle strength is 5 of 5 bilaterally in both upper and lower extremities. She does have decreased cervical range of motion secondary to surgical history and within expected limits. Her gait is steady. She has no slurring of her speech, unlike me, and no dysphagia is noted. Her UA showed just a trace of leukocytes. Differential diagnoses include CVA, primary headaches of migraine, cluster, and tension, secondary headache, sinusitis, and upper respiratory infection. CVA was ruled out on exam with no further neurological symptoms. Primary headache of migraine was ruled out due to ineffective medication. Imitrex did not relieve it, and it would have if it were migraine, and because of the length of illness and symptomology, it was ruled out. Cluster headaches were ruled out due to symptomology. This has been a continuous, moderate intensity headache. Tension headache has been ruled out due to no changes in lifestyle. Secondary headache is positive, related to muscle spasms and confirmed sinusitis with an upper respiratory infection. So the diagnosis is secondary headache due to muscle spasm and sinusitis. Treatment plan includes Augmentin, 875 milligrams by mouth twice a day times 10 days, ofloxacin 0.3% instilled into the left ear, 10 drops, twice a day times 10 days. Fiorinol codeine number 3, 30, 50, 325, 40 milligram capsules, 1 every 4 hours as needed for headache, dispense 30. Flexerol, 5 milligrams, 3 times a day for muscle spasms as needed, dispense 30. She's to return in 3 days for follow-up or go to the ER if her nausea returns or if any neurological complaints continue or symptoms worsen. Thank you for listening.